Hello and welcome to Missouri State University's Dietetic Internship Open House. So we're doing this virtual this year. My name is Hillary Roberts and I'm Program Director for the internship here at Missouri State. We also have a combined Master's in Dietetic Internship option if that's something you're interested in as well. It has an emphasis in population health. So as I move throughout, I'll be talking a little bit about both interchangeably. A couple of things to note off the get-go. Let me start. There we go. A couple of things to note are our two areas of emphasis are in public affairs and rural health. We'll talk about those more in a bit. We also have an optional international experience. One is over the summer in Australia, New Zealand, or Spain. The other takes place as a one-week short immersion experience in typically El Salvador. All right. So you can go to our website to learn more about Missouri State. We're located in Springfield, Missouri. There's lots of good restaurants here for sure. The downtown area continues to grow. There's lots of housing in the area as well, lots of student housing. So just more about campus. In the left side, you see the library and the fountains there. And then on the right side, you see our Foster Rec Center. So as full-time graduate students, you are paying the student services fee, having access to all the amenities on campus. And then these are just, this is the building where the MSU Care Clinic is. So the MSU Care Clinic, if you come to Missouri State in our internship, students are working there with our dietitian a couple days every week. The MSU Care Clinic serves the underserved population, specifically those that do not have health insurance, so helping to fill that gap there with healthcare. So our mission statement, similar to some other programs, obviously we're preparing dietitians. Unique to us is the expertise in public affairs or rural health, and then to meet the need of dietetic practitioners across the nation. So we're accredited for 12 interns. This year we accepted 9. And I anticipate that to be the same in the years to come, anywhere from 9 to 12. This is a picture of us at Fancy. So we do go to Fancy when it is close enough to drive. This year we're all going to Fancy since it is virtual. Our program goals, so I want you to be competent to be dietitians, of course. Another thing that's important to our program is leadership, and it's a love for learning. So throughout the program, there's many different leadership opportunities where you are growing those skills. And then thirdly is very important to us, the modeling a commitment to community engagement, preparing graduates who are socially accountable to the community and the profession. So here at Missouri State, we have a mission in public affairs, so that's also a concentration area of the program. And that mission has 3 pillars. We have community engagement, cultural competency, and ethical leadership. And those 3 are very much woven throughout the entire program. One of your rotations is where the students with guidance develops a 6-week rotation in one of those areas of emphasis, public affairs or rural health. And also, I encourage students to be at a site that you want to work at someday. What is your niche? What's your area of nutrition and dietetics that you enjoy the most? And within those 6 weeks, we're trying to fill some type of gap in the community. So we're giving back to the community in some way, shape, or form. So this past May, we graduated our 8th class. So we began in 2012, graduating our first class in 2013. We remain at 100% first-year pass rate on the exam, with the majority passing the first time. And then thus far, all interns are finding employment within a year, if not majority within 3 months of graduation. So I'll talk just a little bit about the masters at this point in time. So, those in the combined masters and internship, you're completing the internship in the first year. And so I go ahead and submit your name to the CDR. You can go ahead and sit for your exam this summer in between the first and second year of the master's. So you've completed the accredited internship portion. you take the exam. So then in your second year of your master's, you could be working part-time or full-time as a dietitian in the community. So many students are choosing that option. Others are grateful in being able to find assistantships here on campus. And those assistantships pay for all of your tuition that second year, in addition to around $1,000 stipend each month. So feel free to contact me to get more information about that. But I think that's a great asset to our program, is you are able to work in that second year in the role as a dietitian, or also getting an assistantship, either one. So again, Springfield, Missouri, you have the 9-month DI or the 2-year combined master's option. Our 2 areas of concentration, and then the master's has an emphasis on population health. About half of the classes are ran through the public health program. And so you're seeing the public health side as well as a nutrition dietetic side within our master's degree. And we have a thesis and a non-thesis option. So with an internship didactic component in the fall first semester, you take 3 1-credit-hour online courses. So you have MNT, population health, let's say population health nutrition, and then food service management. And within each of those 3, there are activities that you're completing on site with the practicum components of that. Otherwise, in those classes, a lot of case studies, group discussions, and presentations. So although they're online, I would consider it a blended format because you are meeting virtually, typically every Monday evening. All right. And so I'm not going to go here. Really, the program requirements for the combined are the same as for the internship. They're not any different. I should say that the admission requirements are not any different. The program requirements are, of course, those are the classes involved. So you're taking clinical epidemiology, research methods, biostats and health science, health behavior, health services organization, advanced population health nutrition, advanced nutrition counseling, and then another one is your principles and skills of public health administration. So those are some of the classes. You can always go to Missouri State's website, go to the search bar and look for that Master's of Science in Nutrition and find our full curriculum. So in the internship in the first semester in the fall, you're at a rural hospital for around 3 to 4 weeks, diabetes clinic for 1 to 2 weeks, your population health nutrition weeks. Sorry, stumbling there because I was just thinking ahead of what all those are. You have one is in corporate wellness, and I have those coming up soon, so I don't need to go over all those right now. And then food service management as well. And food service management, you're at a rural hospital as well as a regional hospital to see a small versus large comparison of food service. In the spring semester, you're spending 8 weeks at a regional hospital, 2 of those weeks being staff relief, and 1 of those being at a dialysis clinic. You also will receive instruction on metabolic support and work with a metabolic support team. And then lastly, you have your 6 weeks in your individualized area of concentration. So that's a 6-week rotation that you'll get to build, and you'll definitely have guidance on that. Otherwise, we do a lot of interprofessional education activities. We have sim lab. So that picture there is in the simulation lab. We're working with pharmacy, social work, nursing, PA, psychology, all with that within the sim lab. So you'd be a part of that. You also get media training, and we go to beef and dairy farm tours. We go to the pediatric workshop at Children's Mercy Hospital each spring, and it's a 1-day immersive workshop. And then we try to always make that either the MOAN conference or a National Academy conference. All right, so our program calendar, just give you a snapshot. So mid-August, you're coming on campus for a week and a half to get you oriented. And you'd have a little bit of pre-work over the summer as well. So all that's just to get you ready for your first day in practicums. You're in T1 at a rural hospital and diabetes clinic is 7 weeks, population health nutrition 6, food service 5. Come back for intersession, that's 1 week didactic, getting you ready for MNT2. And then the very last week is capstone week or review week. You're studying for the RD exam, in addition to providing 2 final presentations. So here's to give you an idea of our sites. Now these are ever evolving, and we're continuing to get new sites every year, not every month, finding unique opportunities for you. So we work with Mercy Hospital Systems. The majority of our clinical rotations are there. So we have a lot of small rural communities as well as Springfield and Joplin. And then Freeman Hospital Systems, we work with them at Joplin and Neosho. So it is important to note that in this program you are driving, and I ask every year, we just as a group decide, you know, who would like to live in the Joplin area, because we have a lot of sites in the Joplin area. And so that's 45 minutes to an hour west of Springfield. And yet everyone will have rotations there, but I always have a couple people live in that area because that's where a lot of our sites are. And then just some more of the rural hospitals. We're at Citizens Memorial in Bolivar, Cox-Barton County in Lamar, Nevada Regional Medical Center, Phelps County in Rolla, Ozarks Medical Center in West Plains. And then for those that have housing in the Kansas City area, Mercy Hospital also. A couple of students get to have a 1-week rotation up there. So otherwise in West Plains, we have housing. In Rolla, we have housing because those are over an hour and a half away. And so we always provide housing there. And then here's our population health nutrition. So you see a plethora, and this is always ever evolving and changing each year based upon student evaluations as well as preceptor availability. So we work with ARC of the Ozarks in Joplin, serving their clients who are adults with intellectual developmental disabilities. We work with the Southwest Missouri AHEC Center. So they provide health education, a lot of times to high school students in the area. Jordan Valley Community Health Center, again, is providing health services to the underserved. Prime is a trucking company located here in Springfield, their headquarters, and so we work with their employee wellness dietitian. We also, depends on the year, work with Bass Pro Shops, their employee wellness program coordinator. Hy-Vee grocery store here in town. MSU Athletics, so everyone will get at least one day with our sports dietitian here on campus. We also have a sports dietitian we work with who has a private practice, and so several students get to work with her for a week. And we have other private practice dietitians. A lot of them are Hayes dietitians, Health at Every Size dietitians, and so that's also a placement. MU Extension, working in rural communities, and then Springfield and Joplin WIC. So food service, we do work with Head Start in Springfield and Joplin, as well as several public schools. Fort Zumwalt is located in St. Louis area, and again, that is only one that we use if the student has housing in the St. Louis area and wants to have a rotation at Fort Zumwalt. And then we have our rural hospitals. Typically, everyone has 1 to 2 weeks food service at a rural hospital or Head Start public schools, and then the other 2 to 3 weeks are with a large facility, whether that's Chartwell's, our food service provider here on campus, or at a hospital. All right, and then our practicum and area of concentration, you have the rural health and the public affairs. So rural health, these are the competencies for each of these. So developing skills to enhance the dietetics in rural communities, you're increasing and demonstrating your rural cultural competence, and then developing the awareness of resources to provide relevant information. Within the rural health concentration area, you would choose a site located in a rural community, completing some type of project, presentation, filling an education gap, or increasing nutrition and dietetic knowledge and skills within a rural community. And then in public affairs, you'll think of more public policy, being the face of dietetics. You're an advocate for health policy. You're also learning grant writing skills, and then developing and demonstrating media proficiency. And so doing media interviews is part of the public affairs concentration area. So you might be having an interview on TV, radio, We're now doing some Facebook Live posts as well, creating podcasts, webinars. Just a lot of times there's different training videos as well. And so again, this is a rotation that as many people love of this program because they just get to design it around what your interests are. And a lot of students end up then getting employed in that area. So take the student there who's sitting at a table at Bass Pro Shops, and she's now working in an employee wellness area. And rural health projects, we had a person 1 year extend her time at El Salvador and stayed there 2 or 3 weeks. And she did a research project with hemoglobin testing and iron deficiency. And you're just going to see lots of different projects. Diabetes education was popular for a few years, providing that. We've had our food preservation classes taught. Got the SNAP cost comparison projects, Women for Wellness classes. It's just really the sky's the limit and your creativity on what your PAC project could be. And here's some public affairs, Healthy Food Pantry Collaborative, Hy-Vee Price Cutters, also a grocery store here in town. Working with the public schools, lesson plan development, providing nutrition education to the kids as well as to educators. 1 year, we had a student, he worked with the theater and dance department here on campus, providing one-on-one nutrition counseling to the students in that program. So the sky is the limit with these projects. Lately, we've had a lot of students interested in pediatrics, and so we've been able to place those students at a pediatric hospital here in town. They aren't able to be a rotation for everybody because they're really limited on their resources, but they like having you all for PAC projects. All right, and then our study away opportunities. So this would be part of your PAC project. So if you went to El Salvador for a week, then you would take your spring break at some time in your 6-week PAC rotation. The Australia, New Zealand, and Spain option is with ISA, International Study Away Programs. And so you'd work with Study Away Office here on campus. And this would be this summer after the internship. So you would just extend graduation by 2 months and have an immersive experience in Australia, New Zealand, or Spain. The person who went to New Zealand, she was at a research hospital and helped develop a research project on, it was prenatal health and gestational diabetes. Our program costs, we're a very affordable program. Currently, tuition for in-state residents is $332 a credit hour for in-person instruction, $339 credit hour for online instruction. And so that's why they have the 2 different prices there. The total comes to right around $6,000 for tuition. For out-of-state residents, again, your online instruction, and you have at least 3 credit hours. Well, in the internship, you have 3 credit hours that are online, your didactic classes, so those are at $339, whereas the practicums are $638 a credit hour for a total of $10,587. And then the masters, I went ahead and calculated for those 42 credit hours what that would be. Do keep in mind, again, your second year, if you get an assistantship, then that tuition would be paid for. And then you do qualify for financial aid. You are full-time students. As graduate students, that is 9 credit hours each semester. Missouri State also has what's called the Midwest Student Exchange Program. And so you are automatically granted in-state tuition if you meet the GPA requirements for that program. And you can learn more at our financial aid, website. But it's, we've had several students from Illinois, North Dakota, Wisconsin. So if you're from any of those states, you would be and you meet the GPA requirement. I want to say it's 3.5 or higher, but I could be wrong. You would just be automatically granted in-state tuition. Okay, so our admission requirements. GRE is not required from here and continuing forward. So you do not need to take the GRE. And our GPA is just a 3.0 over the last 60 hours of academic work. We're more interested in who you are as a person, your beliefs, what you stand for. We're looking for people who I consider genuine and authentic in the interview. We really want to get to know who you are and what makes you go, what excites you, versus your grades. Grades are important. Yes, they're important. But our average GPA of our students is a 3.4, and that's over the last 7 years, because I haven't calculated this year's average GPA. Be sure your 3 letters of recommendation, that one is a dietetic academic reference, one is a worker volunteer, and then the other one can be, either one, your choice. Take some time on your personal statement. Again, we're really looking for authenticity here. Be sure you record all your work and our volunteer experience. We're not looking at a certain number of hours. We just want to see what you've involved in, what leadership, any type of leadership activities that you've been a part of. And then we phone interview anyone who applies who meets our admission requirements are interviewed. And then we'll be using DICAS and D&D Digital, so be sure you don't forget to sign up for both of those. We do not have an application fee. We don't have anything different than what's on DICAS. We just use DICAS application, make it easy. You pay no fees to us to apply. Once you're accepted, the graduate college waives your fee as well, because you already paid a fee to DICAS. So Missouri State is very aware of the fees all the different fees, and trying to keep your education affordable. You do have to pay what's called a $500 placeholder fee, called a confirmation deposit. That just holds your spot in the program. And then the first week of September, that is then applied to your student account. And so you would then get that $500 back, either go towards your tuition, books. Okay, so we value leadership and professionalism, communication skills, being able to connect with people, collaborating with others, wanting to collaborate with others, and then I would add on here authenticity as well. Just kind of having an idea of who you are, and being kind, giving back to the community. Those are all values of ours. All right, so do not hesitate to contact me. My email is hroberts@missouristate.edu. I did not put my phone number on here, but you could certainly call as well, 417-836-8884. I've been meeting with a lot of students via Zoom, so don't hesitate to email me and we can set up a Zoom meeting. And otherwise, check out more information is on our websites. And thank you all very much for considering Missouri State. Thank you.